Hi. So I know you are interested to know how you can work with us on more effective weight management, which could be free from dieting, restrictions, something that you feel you can sustain. Maybe you've been finding it difficult to lose weight and you just don't seem to be able to find the way forward as a lifestyle, as a way of life. So I'd like to tell you how we go about helping our patients manage their weight in a healthy way, understanding their hormones under our medical supervision in a way that they enjoy and therefore they find it sustainable. So before I get into how we go about it, it helps to just check whether this has been your experience with your weight management in the past. Which of these statements do you think are true, or you have been told in the past that these are true? That you need to follow low fat, you need to follow low calorie, eat less calories, burn more calories. You need to avoid all the high fat items like cheese, full fat dairy. Uh, Fried foods are considered to be always bad. Oil is bad. Makhanas are good for weight loss because they are low fat. And again, that calories in, calories out, eat less and exercise more. And guess what? I'm sure many of you have already tried that and it just hasn't worked. I'm sure everybody who's struggling with weight wants the weight to come off and they've tried doing this and it just hasn't worked. And I really think it's time to ask ourselves whether the body is really going to refuse to let go of weight if we were doing the right thing. So if you thought any of these were true or you've been told that, I want to tell you categorically, all of these statements are false. They're all false. Okay. And let me come to how we go about it. Again, and weight loss medication and weight loss surgery. So you may have been prescribed weight loss drugs. There are some drugs approved on the market. One of them is designed to, once you've eaten something that has fat in it, the medication blocks your body from absorbing the fat. So you take the taste and the pleasure of it in your mouth, and then the tablet will cause you to not absorb that fat, and it comes out in your stool as a greasy stool. Very few people enjoy doing that, having oily, greasy stools and malabsorbing their food. And there are other drugs that are trying to suppress your appetite. Now, imagine a medicine that is designed to suppress hunger. Food is one of the basics of survival: food, water, having a safe roof over our heads, and the ability to reproduce and have children. That is the most basic requirement of any race to survive as a species. So, do you really think that Mother Nature is going to allow humans to get into this lifestyle of obesity, overweight, hormone imbalance, and then a pill is going to work to block appetite? And many of the side effects with appetite blocking drugs include depression, loss of taste, nausea, and unbearable side effects. So, would you really stay on this pill for the rest of your life? And the studies have shown that weight loss happened as long as the person was taking the drug. The minute they stop the drug, the weight comes back. No surprise, because the hormone imbalance and the lifestyle is probably there, and the pill was just maybe temporarily trying to block something with incredible side effects. There have been side effects on the heart, on the liver, on the brain, on the lungs. Okay, so really, it's really something I don't prescribe. Weight loss surgery is an option for someone who has reached such a point of overweight that their heart and lungs are not able to cope. Because obviously, the work you and I would do, or what we do with our patients, is going to take its time. It may not take years the way it took us years to reach this place, but it might take months. It probably will take months, weeks to months, because we're changing habits. The number on the scale will change as we change our habits. And I explain this like, a child who has to study for their 10th exams. And if they keep looking at their ninth grade mark sheet, ninth grade mark sheet shows what they did in ninth. And now they're studying with the 10th grade books, 10th standard books, and they're worrying, what are my marks going to be? What are my marks going to be? And they keep looking at their ninth grade mark sheet. Then how will they perform when they go sit for the 10th grade exam? Not too well if they were so distracted by the mark sheet. They need to study their books, they need to know the subject, need to know the subject in and out if a tricky question comes. So, what we teach you is the lifestyle: the nutrition, the sleep, the stress, the exercise, maybe the intermittent fasting. Those are the subjects we teach you, and then the results come. Okay. So, but if you need time to do that, and if there isn't such time, then bariatric surgery may be an option for somebody who medically needs the urgent or rapid weight loss. Again, along with weight, a lot of people have developed fatty liver, maybe even before they get to diabetes, or they don't develop diabetes or pre-diabetes. They might have fatty liver on the ultrasound, on the sonography. It could be grade 1, grade 2, grade 3. Once it goes beyond grade 3, we're talking about more permanent scarring of the liver, which has become one of the most common causes of liver failure around the world. It's actually overtaking alcohol as a cause of liver failure. People who've never touched a drop of alcohol, but because of the carbohydrates and the sugar in the diet, refined carbohydrates, they're getting fatty liver. And that's the liver's way of trying to scoop up all the food that is going out of balance, because the liver's job is to detoxify the body. It's taking all these things which are not healthy for the body and storing it within itself, even though it's actually becoming sick. Okay, so fatty liver is a sign of a liver that's undergoing damage. The good news is that we have seen even up to grade 3 fatty liver reverse completely within months when they worked aggressively. Again, each patient has to sort of bring that commitment and decision to the table in terms of lifestyle change. We bring our 100%, and we've seen people have some amazing reversals just through lifestyle change, no medications prescribed. But what you may have heard is go low fat, because they see fat in the liver, they say low fat, but actually what you need is low carbohydrate. And again, there are some pills and herbs and sort of natural remedies that people talk about. Again, being an allopath, I'm going to stick to what the science says. And fatty liver goes directly with insulin resistance. Insulin is the hormone that is linked with fatty liver. And again, being a hormone specialist, we know all about the relationship between insulin and fatty liver. So again, the lifestyle change will help with that. First, you should know my background. I am a medical doctor. I finished my MBBS at KEM Hospital about 2001, almost 20, more than 20 years ago. And then I went ahead to the US to complete my MD medicine, or internal medicine. That's 3 years of training in internal medicine in Chicago. Then I spent a year as a teacher for MD medicine students, which was a fantastic experience to be a teacher. And then I went ahead to super specialize in endocrinology. What is this specialty? It's after MBBS, after MD medicine, you can decide to super specialize. Some people go for cardiology, that's the heart. You might go for nephrology, that's the kidney. Endocrinology is the hormones. So I decided to super specialize in hormones. That means the thyroid, metabolism, weight, PCOS, diabetes, everything that comes under hormones comes under my specialty. And then I practiced for 2 years in private practice in the US. And then we moved to India in 2011, which is now 10 years. And I was at Hinduja Hospital, Mahim, for 4.5 years. And I was attached to Breach Candy Hospital for a while. And in 2016, I decided to start my own practice, where I decided that I could bring the entire lifestyle experience to my patients. The learning didn't stop after I became an endocrinologist. I was so interested in helping with lifestyle change that I went ahead and became a diabetes educator. I also trained in mindful eating, which means everything such as emotional eating, stress eating, social eating, uh, cravings, late nights, munching through the night, ordering out, what to do when you're with people. All this comes under emotional eating, or overeating, dieting mentality, can't eat this, scared to eat that. All of these restrictions and struggles that we have with food, I got trained in the thinking about that. I also trained an emotional freedom technique. And what is emotion? Emotion is energy in motion, emotion, how energy moves through the body. Guess what? When you're feeling happy, sad, scared, angry, how do you move that emotion through your body? It's hormones. And so, because I was interested in hormones, I became very interested in how the emotions and hormones go together. So I got trained in a beautiful mind body technique called EFT, emotional freedom technique. Again, because as a doctor, we know how to deal with body parts and joints when they're broken or damaged, but we don't know how to teach people about exercise. That's not something doctors are trained in. And so I wanted to know more about exercise for my own personal fitness, and also wanted to learn about exercise to have better conversations with my patients, because they would sometimes say, I have spondylitis, I have a back issue, I have sciatica. Ever since I had this hernia, I can't exercise. So, or knee pain when I exercise, foot pain, reasons why they couldn't exercise. So I went ahead and became a certified personal trainer to have more knowledge to talk to them about these things. My spiritual turn came in 2013 when I was going through a personally rough patch and I was emotionally down. It was probably one of the hardest phases of my life. And I turned to spirituality at that point. It doesn't have to be God, it could just be that you believe that somebody's in charge of making sure the sunrise happens every morning without fail. And whoever set those things in place and created the human body, whatever wisdom that is, I connect to that and I feel one with that. And that keeps me grounded, it keeps me centered. And I look to connect with that in you and help you connect with that part of you. So whether you call it God or not really doesn't matter, but believing that there's something higher, something positive, that we are all here to make the world a better place. And that came to me through Reiki, but I still learn various ways. I read about this, and a lot of my conversations with you will include topics about our emotions and healing our negative thoughts, negative emotions, because that has such a big impact on our health. Personally, when I went through Reiki, I was able to do some things with my own health, which I'll come to in a little bit. Also, habit change, right? Because if I'm looking to be your doctor and trying to give you as little medicine as possible, but still have you reach better health, I don't have a magic wand. I don't have some blessings that come out of my hands. So, what are we going to do together? We're going to work on lifestyle change. What is lifestyle? It's habits, it's behaviors, it's all the old habits that brought you to this point. What needs to change so that you can have better health with less medication? So, I had to really study and enjoy learning all about what it takes for us to change our habits. So, that's a big topic of interest of mine. So the difference between a common weight management approach that you may have seen elsewhere and what we do is the difference between looking at it through calories versus hormones. The calorie theory may say eat certain amount of small frequent meals through the day. They suggest that eating all day long keeps your metabolism high. A lot of times we've seen that these people are trying to eat low calorie, they're hungry, and then they're eating again. So those three meals and three snacks are just happening because there isn't enough protein and they're hungry all the time. So it's carbohydrate, carbohydrate, carbohydrate. It's low fat, but it's carbohydrate. So they're constantly hungry and they're missing out on enough protein. And protein is very important, especially during the pandemic. We're talking about immunity and things. When you don't have enough protein, how are you going to make your antibodies? Antibodies are protein. They need protein to be made. Muscle building, body strength, sitting at home in this lockdown, not getting our movement, we're losing muscle. Again, protein, even if you are exercising, you need the protein in your diet. Dieting thinking, people are supposed to tell you what to eat or tell you what to not eat. They give you lists of do's and don'ts, what's allowed and not allowed. They might give you cheat foods or pleasures or indulgences or guilt free. All this language, it's just food. Okay. If you know it's sugar or you know it's dessert or you know it's fried, you know it's greasy, oily, if you're choosing to have it, then why call it guilt or cheating? It's such a strange psychology that you're the one choosing to have it and you're the one planning for guilt a few moments later. Okay. It's a split in your own choices and it's a mind body disconnect. Okay. And look, if that's working for you, great. But the people who we end up working with are the ones who have found that this was not satisfying, was not rewarding, not sustainable. And then they were yo yoing, going a few weeks on dieting thinking, and then a few weeks on overeating thinking, and like a yo yo going about it. We want to teach you how to understand your weight from a hormone perspective. We will get you to intermittent fasting through nutrition, sleep, stress, and exercise management first. Okay. We will focus on low carbohydrate. We will make sure your protein reaches a basic minimum. This is not a high protein diet. This is a basic minimum. Globally, the recommendations for protein go a lot higher than this. And zero point 0.8 in many countries is considered low protein. But you'll be surprised, many people in our population are on zero point 0.4 or zero point 0.5 grams of protein per kg per day. So when we tell them to increase it, they think it's a high protein diet. This is not a high protein target at all. This is a basic minimum. Whether you work out and go to the gym or not, this is a basic minimum. We will not have you obsessed with the weighing scale. We will teach you to understand that as you lose inches, as you lose body fat percentage and build body muscle percentage, lean tissue, the number on the scale is less important than your overall fitness, sense of well being, energy, strength. And the healthy changes that you make in your lifestyle will reflect in fat loss over time. So it's a body composition that we are looking at. And again, the opposite of dieting. We want to know your preferences. There will be no diet chart. I do not give out diet charts to anyone. We've had calls. Can you show me a sample of your diet chart? I want to know if your Aasaan diet chart will work for me. No, we don't give out a diet chart. Nobody in my house follows the same diet. All four of us have different likes and dislikes. So, what do you like? How do we incorporate your thoughts into the plan? Because if you don't like it, you're not going to sustain it. Mind body connection, flexibility. What do I do when I'm traveling? What do I do when I have friends over? Again, if you're in dieting world, they'll say avoid this part of the buffet, avoid that part of the buffet, as though the food is like jumping out and jumping onto your plate and taking over your brain, right? So we teach you not to be scared of food. We teach you not to be scared of eating or environments where there is all kinds of food available. We want you to learn how to enjoy that and come back with an approach of flexibility, balance, and moderation. These would be the philosophies we use when we work with you. All these bubbles will be covered with you in a lifestyle change approach. All of these bubbles matter when it comes to lifestyle. We have seen that when we cover all these in a comprehensive way, step by step, it's like coming to school. It's like coming and enrolling in a class. So if you come into our school, these are the subjects we will teach you over time, coaching you step by step, monitoring your blood tests and your medication doses. So I like to give an example of the car. And if you start working with us, I'll always say, do you remember the car? Do you remember the first lecture where I told you about the car? This is that car. The four wheels of the car: nutrition, sleep, stress or spirituality, exercise. Once the four wheels are tuned up, we can look at the medications, we can try and adjust the dose. Once the car is fully ready, if you're an adult, we can talk to you about intermittent fasting as a treatment approach. But imagine you want to go on a long car journey on the highway. You want to take the car for a long drive. You won't go with a puncture. Won't go with tires which are not properly checked up. So even if one of these tires is not okay, your car won't move. Doesn't matter if the other three are fine. Same goes with intermittent fasting. Even if you're doing three things perfectly, if one of them is out of place, your experience with intermittent fasting may not go so well. That's why we do medically supervised intermittent fasting when we are working with someone who has a diagnosis of a hormone imbalance. Okay. And guess what? Life happens, right? So the way life has to give you ups and downs, the same way the road has bumps and a well-tuned car can manage and navigate the bumps, same way life throws ups and downs. We will teach you. We're sitting on your shoulder, coaching you every step of the way for at least 3 to 6 months. Life's ups and downs will happen, and we will teach you how to think through nutrition, sleep, stress, exercise, and fasting through the ups and downs of life. It's not a detox, it's not a diet, it's life. So whatever you learn with us will be something you can sustain, because you didn't have to go into some retreat or some runaway place or escape, getaway, check in to a retreat or a detox plan. You're going to do it in the middle of your life. So you don't need to be perfect. We learn through the experiences you share with us. So what does it mean to have comprehensive hormonal well-being when we talk about nutrition, sleep, stress management, exercise? Remember, I'm a hormone doctor. All of these four components connect. The same way the four wheels of the car are connected. You can't see it, but all the four wheels are coordinating with each other below your car so that your car goes in the right direction. Same way, nutrition, sleep, stress, exercise, they are in coordination through hormones. But there's a lot that happens under the surface. We will work you through these. We have the expertise to help make these things simple. It's a bit complex. You can see how it gets intertwined. These are all the hormonal connections that go on, and we will work with you at every step. Each of these arrows represents a hormonal system. Each of them could be 1 hour lecture, and we'll teach it to you. You don't need to become a doctor. You don't need to understand medical terminology. You just need to understand your body, and we'll teach you how to understand your body and get a better relationship with your own physical being. So the way forward with us would be that we want to work with you to reduce your medication for any hormone imbalance. Goals would be inch loss at the waist, body fat percentage going down, body muscle percentage going up. So we will not be obsessing over the weighing scale. You will not be asked to weigh yourself every day, every minute, every hour, after every meal, and after every visit to the bathroom. None of that. We don't want you torturing yourself with the weighing scale. If you have fatty liver, early stages, it does get reversed. We need to act aggressive. We want reduction in markers of cardiac risk, better immunity, better energy. In COVID times, everybody's talking about immunity. It's not just about only vaccine. Yes, you should get your vaccine, but we need to do many things with nutrition, sleep, stress, exercise to support a good, healthy immune system. No restrictive dieting. We need you to be free from that. You are in charge. There's no thing that you have to keep controlling yourself. I have to control this. I get cravings. I have to control my cravings. We don't want you to be suppressing cravings. We want you to learn how to understand your cravings and get to the root of it. And then you get to decide if you want to eat it, you can eat it. It's always up to you. Okay. You'll be in charge and we'll empower you. We'll teach you how to be empowered with those choices. Eventually, even though you might have come to us for a hormone condition, what's going to happen is side benefits: body pains, sleep, acidity, headaches, other hormone imbalance issues, fluid retention, bloating, so many things which was not the primary reason they came to us gets better in our patients because we are going at the root. We're helping the body fix whatever it wants to fix, whether it's nutrition, sleep, stress, exercise, or fasting. These approaches help all these other so-called unrelated symptoms get better. Actually, everything is connected. The whole body is connected, right? So those are the things that you can look forward to when working with us. And one last thing I'd like to share with you is how it works. What can you expect when we start working together is there would be a consultation, a medical evaluation, there would be coaching, there will be you will be involved in a community where you can ask your questions, learn from other people's experiences. These are all people who we've worked with directly. They're graduates, they're alumni, and we like to stay in touch with them lifelong. So it's a very well trained group of people who have understood these things that you're about to learn. I have created learning videos for you, which you can watch. It's in your mobile. You can just press and watch whenever you want. And we get a very systematic approach to your health data so that you can understand where things are going. And we give you one-to-one chat support. So that's the way we can create a proper whole experience with you at the center of the whole system. So I look forward to hearing from you. I look forward to knowing what it is you're, interested in doing. How we go about it is at least 12 calls over 3 to 4 months. Only if somebody has done a low carb approach before, then they might be okay to do 6 calls, but you need to have already got some good confidence with low carbohydrate living. And it's a 6 months chat support as well, because we know that even once the calls are done, you will need some support to actually maintain those habits. And then beyond that, it could be periodic coaching and periodic hand holding whenever you need. It's like going for yoga. Once you do yoga, you have to know how to keep doing yoga. When you do music class, you need to keep doing your practice. So having a healthy lifestyle requires practice. It requires some like-minded individuals who are there in the back of your mind so that you can remain on track, again, keeping those healthy habits that you've built with us. We will adjust your medications and review your blood tests, and all the solutions will be customized. So each of you who starts with us, you will get an individualized plan. None of you will get the exact same plan because each of you are different. Even down to your thumbprints, you are different. Your fingerprints are different. You're even within the same house. Within my house, 4 of us living here, we have different likes and dislikes. So we have different solutions for the 4 of us in my own home. I'm not able to create a one size fits all plan for any of the 4 of us. We're all unique. So your solutions will be unique. It'll be a partnership. We bring the expertise of the hormonal and the medical and the lifestyle change. You bring the expertise about you. You are an expert in you. So we want to work with you. It's an equal platform. There's knowledge going on both sides. So we can go to the common goal, which is better health with less medication.